When a workplace injury strikes, the road to recovery can feel overwhelming, but it doesn't have to be walked alone. The team at PAM Health is transforming the rehabilitation experience by taking a whole person approach, addressing not just the physical healing, but the emotional and the mental journey that comes with it. Joining us in studio on this Wellness Wednesday is Amber Barlow and Whitney Larkin. Thanks for joining us.
Yes, thanks for having us.
You know, when someone experiences a workplace injury, it's like their world is just crashing down right in front of them, and they can't do anything about it. So I can only imagine how just overwhelming it is. But what are some of the biggest challenges they face beyond just the injury itself?
I think the biggest challenge is uncertainty. What does the future hold? What is the work comp process? Who do they need to call? Who do they need to communicate with? And for us, that's what sets our program apart is we have a dedicated work comp representative who helps the patient navigate and communicate with the employer, communicate with the case manager, communicate with the care team to really help them be the easy button for them to guide their care and make sure they can focus on recovery, and we'll take care of the rest.
Well, that's amazing because a lot of times it's like you're having to rely on family to do that. Maybe you're getting a lawyer involved and then, you know, their whole team.
Yes.
So why did you want to establish that type of program for your patients?
I think it's important for the patient to make it easy so they can focus on their recovery, and we can help them focus on coordinating all of their care. So we really focus on individual care, goal-oriented care, and then our work comp representative helps communicate in our weekly interdisciplinary rounds and communicates with the case managers, their employers, with the patient so they can get back to their career, get back to their family, and really regain their independence.
And get their whole life back again, which is the absolute goal at the end of the tunnel here. But Whitney, can you kind of walk us through what happens the moment a patient is referred to this program?
Sure. The moment we get a referral on a patient, whether it be from a doctor's office, from a work comp adjuster, from a hospital setting, we have a licensed clinician who we call clinical navigator to the bedside within 2 hours. So they are talking to the patient, talking to the family, gathering that baseline information, and at the same time, they are involving our work comp executive who is on the backside while the navigator's with the patient taking care of those forefront needs. That work comp exec is on the back end working, reaching out to case managers, adjusters, and things like that, getting that ball rolling so we don't waste any time. But the first thing we do is ensure that that patient understands the process and we understand what does that patient need.
And of course, you know, we want to address the injury at hand, but you also want to focus on the emotional and the mental side of recovery as well. I mean, May is Mental Health Awareness Month, so we're very at the tail end of that. But again, you want to put that towards the forefront as well with your patients.
Yes. So mental health and recovery from illness and injury, especially workplace injuries, is the top of what we do. Part of our mission is to be one of the most trusted providers in the community, and trust is big to us. And how do we do that? We approach each patient in each situation with an individualized approach. So we offer psychiatry and psychology services. So we have a psychiatrist who can evaluate and medicate if needed. But then we have a psychologist in counseling that can come in while they are inpatient with us and sit down with them for an hour-long counseling session to address those socioeconomical, those physiological, emotional needs, all of those things, because that's a huge piece to recovery. People who are determined to recover are going to recover faster. That's statistically proven over and over again. So that piece of it cannot be neglected, and that's something we take pride in at PAM Health.
I know, and just having that team of people, not just to help that patient recover, but also everything else on the back end, because that is just a whole process in and of itself. So ladies, thank you so much for stopping by.
Absolutely.
Thanks
Thank
for
you.
having us.
All right, to learn more about all of their programs, just head over to pamhealth.com.